Nobubele Volsak, who's the Director for Women Development at the Eastern Cape Department of Social Development, joins us now to expand on this matter. Very good evening to you. Thank you so much for your time. I mean, shocking revelations this, as we continue to hear about the impact of those who are undernourished as well as malnutrition, which really speaks to matters closer to home. Talk to us a little bit about some of the contributing factors which have resulted in such a devastating outcome.
Okay, good evening, Paul, and to the SABC viewers. Thank you for having us as the Department of Social Development in the Eastern Cape. Firstly, as the Department of Social Development, we are working on the program of malnutrition and child poverty. This is a challenge indeed in the province, but the department, together with various stakeholders like the Agricultural Research Council, as you have mentioned, we are working on a strategy that we are implementing of food security and nutrition to try and deal with the challenge of malnutrition in the province.
In strategizing, one would assume that you have done a significant amount of research to really understand the big why. Why, under your government, that there's so much suffering. I mean, this was even exposed by the South African Human Rights Commission, saying that the level of malnutrition, more so with children in the Eastern Cape, is so high, it should be declared a crisis.
Yes, the level of malnutrition is high, and the contributing factors include COVID-19, which was experienced in the whole country. So a lot of children who are living in rural areas particularly experience malnutrition, and some of the children are living in child-headed households, so they are on their own. But as the department, together with other stakeholders, we are trying to ensure that children are taken care of. For example, in terms of the Constitution, the Department of Social Development has the responsibility to provide for the right of access to appropriate social assistance to those who are unable to support themselves and their dependents, as well as Section 28, subsection 1 of the Constitution, enshrines the rights of children with regards to appropriate care, basic nutrition, healthcare, and social services. So that's the mandate that we are implementing. Yes, indeed, there are challenges, but we are trying, and we think that the strategy that we are implementing is really making a difference. For example, the program that we designed is called Integrated Mother and Child Development and Support Program, which is aimed at empowering women with children under 5 who are diagnosed by the Department of Health as suffering from severe acute malnutrition. So we've piloted the program in the OR Tambo district, particularly, for example, today we're in Port St. John's, and the program has received a lot of support. So here what we are doing, we were launching, for example, today, a program that we call iCrop, which is a campaign that we want to ensure that children are registered as they are being born by the Department of Home Affairs, who are part of the team, as well as SASA, that is South African Social Security Agency, which is an agency of the Department of Social Development. So SASA is also here, the Department of Health is here, the Department of Agriculture and Rural Development, Dr. Diane Short is also here. Yeah. We also have a number
if you'll allow me, let's talk a little bit about these strategies and how they will empower women. How are you ensuring that women can indeed look after their children through these programs that you're initiating?
Okay, for example, the strategy has got pillars that talk about research, community and household profiling, so that we can understand the challenge and also how profile communities and households where these children live. And then we also have a pillar on food security and nutrition, including food supplements, whereby children are given food and also they are given supplements so that they can be fed and be well nourished. And then we have a pillar on adolescent sexual reproductive health and rights, including women's rights, because according to the stats that we received from the Department of Health, most of the children who are malnourished also are being born by mothers who are teenagers. So there's a challenge of teenage pregnancy. There's a link or correlation between malnutrition and teenage pregnancy. And also we have a pillar on income generation and entrepreneurship, whereby women are taught various skills. For example, the Agricultural Research Council, we are piloting a project that on orange flesh sweet potato, which is rich on vitamin A, because children that are malnourished have a deficiency of vitamin A. So this orange flesh sweet potato is rich in vitamin A. So Agricultural Research Council trains them on how to plant, for example, crops like this sweet potato, not only sweet potato, but it's one of them. And then they also teach them skills on agro-processing as to what they can do about this sweet potato, so that they can also sell it and generate income and also feed their children in various forms.
Yeah.
And then there's also a pillar on skills training and capacity building and empowerment of women, as well as monitoring and evaluation.
Some of the discrepancies that were noted in the Eastern Cape, where child food poverty rates are the highest in the country, spoke a lot about underspending for critical programs, also being noted as per some of the submissions from the provincial treasury, and the notable pattern of underspending, especially which now amounts to around 500 million rand in the past 3 years as of 2023. How are you ensuring that these programs benefit the people that they're meant to benefit, and that there is no underspending insofar as assisting and bettering the lives of those in need in the Eastern Cape, more so with empowering them with tools to be able to ensure that they too can bring money into their pockets?
Okay, as the Eastern Cape Provincial Government, led by the Office of the Premier, we try and ensure that all departments, they spend the budget that is allocated to them. So this program of dealing with malnutrition and poverty, child poverty, we are trying to ensure that we prioritize the budget, and we also prioritize the allocation in terms of each stakeholder utilizing the budget that is allocated. So the budget, for example, that is allocated for malnutrition, we try not to underspend on that one and ensure that we spend it accordingly.
And very lastly, what will happen should it be underspent at a time like this, where malnutrition and undernourishment is now being seen as a crisis?
That would be very sad, and really we do not want to see children dying as a result of malnutrition, because, as you have indicated earlier, the South African Human Rights Commission conducted an inquiry in the province around this challenge, and it raised a lot of findings and recommendations of what needs to be done. So, for example, the program that you are implementing now is part of what has been recommended by the South African Human Rights Commission, and we are obliged as various departments and stakeholders to report to the Commission on a 3-month basis as well as 6-month basis. So we are really committed to implement and ensure that no child dies because of malnutrition. That would be a violation of their rights, because every child has got a right to life and has got a right to food.